So I wanted to ask you about long COVID. As a cardiologist, I see these people with the presumed diagnosis. What I'm seeing is autonomic dysfunction. They have COVID and then they have some recovery, but they're really struggling with postural symptoms. They stand up, they get lightheaded, they do minimal activity, and their heart rate goes through the roof. I, as a cardiologist, do all the tests and say, yeah, that's really abnormal. But it's an autonomic problem, not a heart problem. Your heart's fine. It's an autonomic problem. But I know long COVID's a lot more complicated than that. Discussing with it, often it's brain fog, it's fatigue, it's other factors. And how to handle these people with these multi-system multi-system issues in a system that's very siloed. I'm guessing that you get these people in your practice as well.
A lot. And I've treated so much of the long haul at this point. One of the big things that I was able to pattern pretty early on during COVID, because we were typing it, we found a specialty lab that was typing it, so I knew exactly what type it was, and I knew how it was going to respond. And so I was actually able to individualize some treatments for patients at that point as they were going through, SARS-CoV-2. And in that, what I was realizing is that a lot of people had Epstein-Barr, which very common. Lots of people had mono growing up, not necessarily anything to write home about. But it was reactivating it. It was reactivating all these other viruses. And sometimes people like to say, oh, it's like a little viral parade. But when it reactivates all those, what was happening is that their white blood cell count was dropping. And so then they would have these chronically low white blood cell counts. So I see this quite a bit in my practice. And I think if you have a low white blood cell count and you're immunocompetent, your immune system is okay, and you don't have any problems here, then why are you chronically fighting an infection? So I start digging for infections and see, are these reactivated? And so that was a big piece of long COVID for a lot of people, or is a big piece. And then there's other things that we know it's triggering, multi-system issues, and we know, microclots, and we know, inflammatory cytokines, and some of the cytokine cascades went crazy. And so early on, I started using low-dose naltrexone because I've used it for years with my autoimmune patients. And I said, hey, is this going to work? And it's funny because I remember reading the New York Times a year or two, probably a couple of years ago, and they were like, novel new medication that's used for substance abuse and recovery is working for long COVID. And I was like, I'm so glad you caught up and put that out there. Lots of us are using this, and what we're doing is just calming down the immune system.
Interesting.
So that's what a lot of them are dealing with. And during this, your immune system can only work so hard. While your immune system is working really hard, your adrenals are working hard, right? So it's putting out cortisol. And while I think, adrenal fatigue is overused a little bit in our society because people don't necessarily know, maybe it's your thyroid, maybe it's something else, maybe it's your hormones, maybe it's not your adrenals. They are playing a role in here, and we can see that very clearly with running things like, cortisol and testosterone. Their testosterone will go low, their cortisol will go low, their DHEA might be low too, so that's upstream. So we have to look at that. So now we're just looking at biochemistry. So that's how I'm looking at it for a lot of those patients. And then I have some novel things in my office because I use a lot of ozone therapies. I have EBOO, which is extracorporeal blood ozonation and oxygenation, which has been used in Europe forever. And it's really used, you probably know it from cardiovascular and peripheral artery disease, but it's really beautiful because it's got, ozone, UV, and LED, so it's killing infections without affecting our blood, and then they're getting hyperoxygenated blood because ozone doesn't stay ozone. And anybody who says it does is silly. They don't understand the chemistry of it. But yeah, so that's my,
So you have
2
a
cents
pretty
on it.
comprehensive approach to these people, and you've been
Huge.
getting results for them as
Huge.
well, which I have to tell you from my perspective, and I don't see a lot of these patients in longevity practice. It was more my prior practice, but they weren't getting answers in many places. They were getting a lot of, well, everything looks okay, or you have this, but I don't know what to tell you. And so